All right, we ready to do a quick testing? Yeah, all right. Can you guys hear me through the webinar? Testing, testing, 1, 2, 3. Yes? All right, perfect. Good morning, everyone. Welcome to our eLotus webinar today. My name is Donna, and I will be your host and your moderator for today's class. Here at Lotus Institute of Integrative Medicine, we are the leading acupuncture CEU provider, offering the largest selection of CEU courses for acupuncturists. So if you're here looking to learn something that you can apply in your practice right away, you have come to the right place, and we are so glad to have you join us today. Here at eLotus, some of the things that we offer are the weekday webinars, such as today's class. They're free for you to attend, and they're educational courses. If you miss it or if you want to watch it again, we do record them and archive them on our TCM Wisdom Tube, so you can catch it on there on the next business day. Today's class is an intro to Chinese herbal medicine. It's a series that Dr. Chen is doing with us. Each month he will be teaching an intro herbal class. So today's topic is heat clearing. Dr. John Chen is a recognized authority in both Western pharmacology and Chinese medicine. He is the lead author of Chinese Medical Herbology and Pharmacology and Chinese Herbal Formulas and Applications. Both books are currently on the California State Board as well as the NCCAOM as required texts. Dr. Chen is also currently a medical consultant with Evergreen Herbs, and we are so honored to have him join us today. Let's go ahead and give him a big warm welcome.
All right, hello everyone. Let's do a quick sound check. So if you can see me and hear me, please let Sam know in the chat room before we start. Hello? Okay, looks good. All right, hello everyone. Our topic today is going to be the heat clearing herb. And this is actually one of my favorite category of herb, mainly because they have excellent pharmacology and also clinical applications. So I think understanding the heat clearing herb from both TCM and Western medicine perspective is going to be very important toward getting the most out of these herbs when you treat your patients. All right. So the definition of heat clearing herb is that these are the herbs that clear interior heat, purge fire, cool the blood, eliminate toxins, and also clear deficiency heat. All right. So these are the TCM definitions. And obviously, to be able to use these herbs effectively, you need to know what heat is, what heat syndrome is, and also when and how they can correctly be applied in clinical settings. All right. So even though these are very basic TCM terms and concepts, nonetheless, I think it's important to refresh our memory just a bit. All right. So to correctly apply the heat clearing herb, we have to have a good understanding of what heat is, and also be able to differentiate and identify the pattern differentiation of different kinds of heat. All right. So the very first thing is to understand the different terms that are commonly used. So generally speaking, we will use terms like warmth, heat, and fire, and basically understand that these are all the same thing, just different intensity. All right. So herbs that I describe as warm would be slightly warm or moderately warm. Heat would be a stronger word, and fire would be obviously the most intense term. All right. So these are the terms that we use to describe the heat conditions in the body, from mild to moderate to severe, which would be warmth, heat, and fire. Okay. And these terms can then be attached to describe heat at different locations and different levels. All right. So for example, we will then describe exterior warm condition or interior heat conditions. All right. So the differential diagnosis here is whether the heat is affecting the exterior parts of the body or the interior parts of the body. All right. So in our last topic, we talked about exterior releasing herbs. So in that chapter, we talked about exterior heat or herbs that have heat clearing effect for the exterior. All right. So we're not going to repeat that here, but rather our next hour will be focused on herbs that clear heat from the interior, or interior heat clearing herbs. All right. So this is a very quick divide for differentiating heat affecting the exterior parts of the body and also the interior parts of the body. And quickly, exterior heat is mostly something that describes the exterior wind heat or exterior common cold, influenza, infectious disease. So in most cases, the very early stage of an infectious or inflammatory condition. All right. And once the disease has passed that initial phase and goes more interior, now you're looking at an interior heat condition. And in this case, require the use of herbs that clear heat from the interior. All right. And if you were to go a little bit more in depth, all right, there have been different schools of thought and different schools of TCM that describe how the disease go from exterior to interior. And if you look at it from a Wenbing, which is warm febrile disease perspective, it often describes the disease to go from the upper parts of the body to the middle to the lower parts. So in this case, they use a specific term, the disease going from upper jiao to the middle jiao to the lower jiao. So the upper jiao is basically the lung area. All right. So if the patient has heat in the upper jiao, they will mostly have some type of lung heat or heart, something in the upper parts of the body. Middle jiao is mainly the stomach, the spleen, the intestines, the liver, the gallbladder. Okay, so if there is any type of heat manifestations in those areas or those organs, it's generally going to be described as heat in the middle jiao. Okay, and then the lower jiao generally describes the bladder, the large intestine, the genital urinary system. Okay, so if the patient has heat in the lower jiao, it may be something along the line of maybe urinary tract infection, maybe cystitis, maybe constipation, things along that line. Okay, so this is going from upper to middle and to lower jiao. All right, and more specifically, you can also differentiate heat based on what organ is affected. Okay, so based on which zang or fu organ, which solid and hollow organs. All right, so once again, these are the pairs that are generally described in TCM: heart and small intestine, lung and large intestine, liver and gallbladder, kidney, urinary bladder, spleen, stomach, and then pericardium and sanjiao. All right, so you can do a pattern differentiation based on where the zangfu organ is. And historically in TCM, this is one of the very common way to diagnose the condition and also to prescribe herb for the patient. All right, so let's say if you are the patient, right, and you complain about cough, wheezing, dyspnea, chest congestion, more than likely you'll be diagnosed as having lung heat, right? And when the herbal formula is prescribed, most likely it will be a formula of some kind that clears heat from the lung. All right, and same with the other organs. Maybe the patient would have insufficiency heat of the kidney. Okay, in that case, they may have menopause, they may have hot flashes, they may have restlessness or bone stinging sensations and so on. All right, so these would be the general signs and symptoms associated with heat at different parts of the body, and more specifically different zangfu organs. All right, I would say in this case the main thing to keep in mind is that you will come across many formulas, and we'll talk about them a little bit later, that describe what the formula does from a TCM perspective. So for example, you have Qing Wei San, which is clear stomach heat powder. Okay, you have Qing Fei Tang, which is clear lung heat decoction, and so on. All right, so the formula with this pinyin name will tell you what it does. Okay, so the main thing here is to realize that the Chinese zangfu organ is not always the same as the Western anatomical organ. Okay, so Chinese organ describe not only the organ itself, but also many of the function that it has from a TCM perspective. All right, so lung and stomach are more similar from a TCM and Western organ perspective, but when you look at other organs, maybe the liver, okay, or the kidney, it's going to have some similarity, but also some differences. If you look at organs like sanjiao, then obviously it's completely different. You don't have a sanjiao in Western medicine. So then you have to interpret strictly based on TCM paradigms. All right. So anyways, my point here is the Chinese pinyin name for the herb and for the formulas tell you quite a bit about what it is and what it does. but make sure you think back to what is originally trying to tell you from a TCM perspective. All right? Okay. You can also do pattern differentiation based on how far the heat has penetrated in the body. Okay, so when we talk about upper, middle, and lower jaw, it's just strictly location. Okay, but when you talk about weight, defense, qi, energy, yin, nutritive, and xue, blood levels, you're talking about how far the heat has progressed, and in a way, it tells you how severe the condition is. All right, so if the heat is mostly a weight or defensive level, generally speaking, it's at a very early stage. Okay, so in this case, heat is mostly at the exterior, so not that different from exterior heat or wind heat. But then as it goes farther and farther deeper, you will then go to the energetics level, then nutritive level, and also the blood level. And when the heat gets to the nutritive and blood level, generally speaking, it's going to be quite serious. At that point, the heat has damaged a lot of the internal organs or has damaged a lot of the body. Okay, so then it becomes a lot more serious, and then you need to basically take it much more seriously and correct the disease much faster. Okay. All right. And then we also have to describe the heat in different characteristics. All right. And generally in TCM, we would use terms like this: heat and fire, heat and toxins, damp heat, and also deficiency heat. All right. So heat and fire basically are the same thing, describing a little bit different intensity. All right. So you may say heat and fire of the liver, heat and fire in the lung, and so on. All right. So in a way, it is describing the characteristic of the heat along with what organ is affected. And generally speaking, also, heat and fire tend to have a more broad effect or more systemic effect. All right. So in the case of lung, obviously the heat and fire can rise and affect not just the lung, but other parts of the body. If you talk about stomach, same thing. Heat and fire can affect not just the stomach itself, but also rise and affect other parts of the body. All right, so heat and fire generally tend to affect more than one specific location. Okay, and in contrast to that is the damp heat. Okay, damp heat generally tends to affect or describe problem associated with the localized area. All right, so maybe things like damp heat affecting the liver. Okay, so in this case, you may have an infectious or inflammatory condition of the liver. All right, so the patient may have hepatitis, okay, or liver cirrhosis, or some type of condition with the liver. All right, or you can have damp heat of the gallbladder. All right, so in this case, the patient may have jaundice. Okay, or you can have descriptions such as damp heat in the lower jaw. Okay, so that would be a urinary tract infection, maybe gonorrhea, maybe cystitis, maybe bladder infection, maybe kidney infection. All right, so once again, when damp heat is used, it's generally to describe some kind of infection or inflammation more in a localized area. Okay, and heat and fire, in opposite, is to affect a broader general area. All right, then heat and toxin is generally to describe a condition of heat and infection and inflammation in which there is something also abnormal. Okay, maybe the presence of pus or abscess, okay, or some kind of discharge. Okay, or it could also be used to describe if the pus or abscess or discharge is not released. Okay, it starts to form and then it becomes a nodule or hardness. All right, so things like this may be used to describe cellulitis or sores or carbuncles. Okay, or heat and toxin can be used to describe some type of cancer or some type of tumor. Okay, so these are the general descriptions for heat and toxins. All right, and then what happened is all these excess conditions with heat and fire and toxins and so on eventually will gradually damage the qi and dry up the yin. All right, so over time, not only do you have a heat condition, you also have an underlying deficiency condition. And that deficiency could be deficiency of qi or deficiency of yin. And what that means in Western medicine, or to see it from a different perspective, is that indeficiency describes the atrophy of the organs or damage to the tissues. Okay, so slowly over time, the inflammation is damaging the organ itself. Okay, so for example, if you have somebody with rheumatoid arthritis, right, the arthritis itself is obviously an inflammation of the joint and also the musculoskeletal tissues. All right, so in the beginning, it's an inflammation condition. But over time, what happens is the inflammation slowly damages the tissues. It damages the bones, it damages the cartilage, and so on. So initially, it comes with inflammation of the joint, but over time, as the joint becomes deformed and damaged, okay, it goes through atrophy, and the joints becomes twisted, becomes deformed. Okay, so that is your indeficiency and heat. Okay, it can also describe Qi deficiency. Okay, and what that means is, let's say you have a chronic smoker, okay, or somebody with chronic tuberculosis. All right, so what happened is with the infection in tuberculosis or smoking in heat, what happened is the heat will gradually damage the lung and decrease the lung function. All right, so over time, not only do you have deficiency heat, which is the smoking or infection, you also have a decline in lung function. Okay, so that's lung qi deficiency. So now you end up with deficiency heat of the lung. All right, so that's generally speaking a chronic condition characterized by some type of infection and inflammation, along with decrease in function of the organ or damage of the organ. And that's where you had a deficiency. All right, so these are all many ways to describe heat in TCM traditionally. And so when you decide to prescribe heat clearing herbs, you need to make sure you have a clear pattern differentiation of the heat, so you can use the correct heat clearing herb to treat the condition. All right, from a Western medicine perspective, okay, generally speaking, these patterns of heat, fire, and warmth describe various type of fever, infection, inflammatory disorders. So we talked about many of those already. And also they describe immunological disorders. All right, so what we're going to see more and more today and in the future is specifically the autoimmune disease. Okay, autoimmune is a condition in which the immune system becomes hyperactive, and instead of eliminating the foreign pathogens or foreign substance, it starts to attack the body itself, the normal tissues and organs. All right, so generally speaking, it's considered to be a heat and fire condition systemically. But then depending on where the tissues and organ is being attacked, you also have a lot of localized heat and fire. So initially it's all heat and fire, but in the long run, as the heat and fire attack different parts of the body, you will slowly have indeficiency represented by the damage, and also Qi deficiency represented by the loss of function. All right, and then tumor is another main indication of heat pattern. And then secondarily, you have a lot of metabolic disorders that also represent heat. Okay, so this could be somebody with hyperthyroid condition, somebody with hypertension condition. You can have somebody with endocrine condition, maybe insulin, maybe diabetes, for example. Okay, and then psychological disorders would also show a lot of heat, right? Obviously, somebody with a lot of stress, anxiety, manic depression, and so on, they show a lot of liver qi stagnation and also liver heat. All right, so these are all the different manifestations of heat. All right, so oftentimes it's not enough to just say the patient has heat and then you're going to use heat clearing herb. You have to be more specific. Okay, where is the heat, what type of heat it is, and then what kind of heat clearing herb do you need to use. All right, you also have to understand that heat clearing herb have many, many different pharmacological effects. Okay, some have antipyretic effect to treat fever. Some have antibacterial effect to treat bacterial infection. Some have antiviral effect to treat viral infection. Some have antifungal. Some have antiamoebic. Some have antiprotozoa, and so on and so forth. All right. So once again, it's not enough to just know this is a heat clearing herb. If you want to get the most out of it, be able to identify exactly what type of heat it is in TCM, and also from a Western medicine perspective, what kind of disease it is, and then choose the appropriate herb with those pharmacology. All right, so that's the general look into what is heat and what are heat clearing herbs. So now let's look into more specifics. Okay, and by that we will examine and look at some of the single herbs along with some of the classic formulas. All right, so you should know, and then we'll discuss some of the herbs that I think you may or may not know. That way, it will be both a good refreshment or refresher, as well as something that's completely new. All right, so the first herb here, most of us should know, is Huangqin scutellaria. So from a classic description, it clears heat and drives dampness, clears heat and sedates fire, and then clears heat and eliminate toxins. All right. So based on how we describe what we described earlier, when you have an herb that clears heat and dries dampness, basically it helps to dry or help to treat damp heat. So this herb has a very good effect to treat damp heat, affecting many different parts of the body. It can actually treat upper jaw, middle jaw, and lower jaw. It helps to treat damp and heat affecting the lung, affecting the stomach, liver, gallbladder, bladder, and so on. All right, so it has a very good effect to treat localized problems. It also has effect to clear heat and sedate fire. All right, so the effect is just not localized, but also has a very broad and general effect. All right, so for those reasons, you see Huangqin used quite a bit in many different formula for many different indications. All right. And then lastly, clears heat and eliminates toxins. All right. So it's also good for diseases in which there's a lot of pus, abscess, discharge, and so on. All right. So this is a great herb. You can kind of look at it as a broad spectrum heat clearing herb. And in fact, it does have a very broad spectrum of antibiotic effect. Okay. And to be more specific, antibiotic can then be narrowed down to antibacterial, antiviral, and also antifungal. All right, so this is one of the best antibiotic herbs to use. Okay, in addition to that, it's also one of the best herbs to use for its anti-inflammatory effects. All right, so what happens is when you combine the two, this is one of the best antibacterial or antibiotic and also anti-inflammatory herbs. And not only is this herb great for treating the infection of the microorganisms, okay, it can also help to treat the infection that occurs at many different organs and tissues in the body, mainly because of the anti-inflammatory effect, right? So when you think about inflammation in Western medicine, what happens is a disease name will generally have an itis at the end of the name, like itis, right? So you can have something like bronchitis, hepatitis, okay, cystitis, gastroenteritis, and so on. So anytime you have an itis at the end of the disease name, that means there's some type of inflammation, okay, at different organs. So what happened is Huangqin has a great anti-inflammatory effect that affects and treats all these different organs. And then when you describe it from a pharmacological perspective, then it has a hepatoprotective hepatitis. It has a gastroprotective ulcer, and also gastroenteritis. Then neuropros useful herb, again, to treat all kinds of infection and all kinds of inflammation. All right. Another thing that's quite interesting is that in addition to just treating the infection, Huangqin actually has a synergistic effect with the drugs to help to potentiate the effect of the drug to treat the most stubborn, the most difficult to treat type of infections. All right. So this reference here says that the addition of this compound from Huangqin called Bacalin will potentiate the effect of many standard antibiotics, such as ampicillin, amoxicillin, methicillin, cefotaxime, and so on. And in fact, will help to restore the effectiveness against bacteria, such as beta-lactam antibiotics or beta-lactam resistant Staph aureus, and also methicillin resistant Staph aureus. All right, so beta-lactam refers to a category of antibiotics that is no longer effective against certain strains of Staph aureus. And then methicillin, of course, is an even stronger antibiotic. So basically what it's saying is when you have a Staph aureus bacteria that is resistant to the drug already, obviously the drugs won't work. But if you were to add this compound to the drug in combination, then the combination of the two would then work well to treat those bugs. All right. So this is one example of an herb-drug interaction, but the result of the interaction is a positive, much better effect to overall treat the infection. All right. The next herb is Huanglian coptis, Rhizoma coptilis. And once again, this is an herb that clears heat and dries dampness, also sedates fire and eliminates toxins. So overall, the effect is very similar to Huangqin in terms of treating microorganism infections and also its anti-inflammatory effect. So once again, if you look at it, this herb has great antibacterial, antiviral, and antifungal effect. So once again, to treat bacterial, viral, and fungus infection. It also has great anti-inflammatory effect to protect inflammation, to treat inflammation, affecting many different parts of the body, including hepatoprotective, cholagogic, gastroprotective, and so on. All right. There's one other thing that I haven't touched on so far, and that is the effect of these herbs as antitoxin. All right. So what happened is if you strictly look at these herbs, whether it's Huangqin or Huanglian, what happened is they do have excellent antimicrobial antibiotic effect. All right. And in that case, drugs do the same thing. Most of the antibiotic drugs also have excellent antibacterial effect. Okay. But there's one thing that herbs do that the drugs really don't do, and that is the antitoxin effect. And what that means is when you have an infection by a microorganism, let's say a bacteria, what happened is in addition to the infection, you also have to worry about the bacteria in terms of the endotoxin and also the exotoxin. Okay, exotoxin refers to when the bacteria is killed. What happened is they are broken down, they are engulfed by the macrophages. But what happened is the bacterial cell wall has something called the endotoxin or lipopolysaccharides. And what happened is these lipopolysaccharides will trigger the body to become hyper-responsive and in turn produce a lot of inflammatory cytokines that cause a lot of local and systemic inflammation. All right, so it's not just an infection that we have to worry about with the microorganisms. It's also the excessive fever inflammation caused by the exotoxin. Okay, and then you also, or endotoxin. Then you also have to worry about the exotoxin, and those are the toxins produced by the bacteria to cause harm to the host. Okay, and one of the best example is the botulinum produced by the Botox toxin produced by the botulinum. All right, so it's a toxin produced by the bacteria that cause damage or kill the host. All right, so in this case, the herbs have antitoxin effect to help to treat not just the byproduct of the infection, but also the infection by the bacteria itself. All right, so a lot of the herbs do have that antitoxin effect, and that is something that is being studied more and more extensive now. Okay, as one of the benefit of the herb in addition to just antibacterial or antiviral effect. All right, and again, Huanglian has also shown great synergistic effect when combined with the drugs. All right, so berberine is one of the compounds from Huanglian that that has effect to treat MRSA, which is the methicillin-resistant Staph aureus. You will lower the minimum inhibitory concentration of the drug and also boost the overall effect of the drug. So what that means is you can now combine the drug and the herb together. The dose of the drug can be a bit lower, therefore doesn't cost as much, will not cause as much side effect, but overall still work just as well to treat the infections. So once again, this is a herb-drug interaction example. And most of the people, when they think about herb-drug interaction, they think this is a negative interaction that will somehow harm the patient or hurt the patient or decrease the effect of the drug. But you have to remember, herb-drug interaction is simply two medicinal substances that interact with each other. You can have antagonistic interaction. You can have synergistic interaction. Okay. You can also have interaction in which one treats the toxicity of the other. Okay, so throughout our discussion of many different categories of herbs, there will be many of these examples that come up, and whenever they do, I'll be sure to share it with you. All right, so the last two examples of herb-drug interactions are both having to do with using herb and drug together to get much better clinical results from the combination. All right, the last of the yellow herb, and by the way, Huang means yellow. All right, so Huang Qin, Huang Lian, and Huang Bai both mean that the herbs are yellow, and all imply that the yellow herb generally have effect to treat heat and fire, because yellow is the color that's designated to fire. All right, so whenever you see an herb that has Huang in it, chances are it's a bitter and cold herb to help to treat heat condition. All right. So Huang Bai Cortex philodendron is an herb that clears heat and dries dampness. So once again, helps to treat a localized damp heat condition. It sedates fire and clears toxins or eliminates toxins. So it helps to treat conditions that has abscess, pus, type of conditions. And lastly, to clear deficiency heat. All right, so this is the one function that's different from the previous two herbs. So this is an herb that helps to treat heat condition that's not just acute but more chronic. Okay, so not just there's some type of underlying individual Qi deficiency. All right, so the body has suffered from some damage as a result of chronic heat condition. All right, so make sure you keep that in mind. So this herb will be more appropriate, not just for excess heat, but also patients with deficiency heat with deficiency. All right. So overall, have good antibacterial, antiviral, and antifungal functions, but it's not quite as strong as far as anti-inflammatory effect. All right. So in a way, it's a good herb, but not quite as potent, and it's moderate in its functions. Okay. In terms of herb-drug interaction, it's very similar, and the reason is because Huang Bai contains one active compound called berberine, and that is the same compound that's also present in Huang Lian. All right, so basically Huang Bai and Huang Lian share many similar pharmacological effects and also TCM functions, as well as herb-drug interactions. All right, another way to look at these three herbs, and this is from a classic description, is that Huang Qin is most effective for upper jiao. Huang Lian coptis is most effective for middle jiao, and Huang Bai philodendron is most effective for lower jiao. Okay, so that's one way to remember, but by all means, it's not a complete description, because a lot of these herbs do treat problems in many other parts of the body. All right, and then if you were to put it all together, you have one herb called Zhizi Gardenia that is effective to treat heat and fire in upper, middle, and lower jiao. All right, so this is an herb that has a much broader effect and is able to treat all throughout the entire body. Okay, TCM description is that this herb sedates heat and relieves irritability. All right, so it clears specifically in this case the heart, heat, and fire that disturbs the Chen and causes irritability, restlessness, insomnia, and so on. It also has effect to clear heat and drain dampness downwards. All right, so once again, clear heat and fire, treat damp heat. Okay, so it does help with localized type of heat problems. It clears heat, cools blood, and stops bleeding. All right, so it helps heat that is going deeper into the body, into the yin, nutritive, and wei, yin, xue, blood stage. And then lastly, reduces swelling and release pain. All right. From a pharmacological perspective, once again, this has very good antibiotic effect. It has antibacterial, antiviral, and antifungal. But the difference is that it is not quite as strong as an antibiotic herb when you compare it with, all right, so Huang Qin, Huang Ai, even though the description is the same, those three are much stronger as antibiotic herbs. Zizi has the effect, but it's not quite as strong. But rather, Zizi is a much better anti-inflammatory herb. It's also a much better herb to treat the hyper or elevated metabolism of the body. All right. So what I mean by that is if you have somebody with increased production of the thyroid hormone, where their metabolism become a lot higher. Okay. If you have somebody with hypertension, characterized by stress and anxiety and so on. Okay. If you have somebody who has increasing heart rate. Okay. So anyways, something that has nothing to do with infection, but the heat nonetheless is there and is characterized by increase in metabolism, hyperactivity, and so on. All right, so in that case, zizi would be a better herb to use to slow down the entire body's metabolism. Okay, so in a way, think of it as a beta blocker or alpha blocker from a Western medicine perspective, right? You have alpha blocker and beta blocker that help to calm a person down, help to reduce metabolism in cases of hyperthyroidism, that help to bring down blood pressure, okay, and so on. All right, so zizi definitely has that effect to calm the whole person down, to reduce the metabolism, and those are all manifestations of heat as well. All right, so in addition to antibiotic effect, zizi generally described to have anti-hypertensive effect, hepatoprotective effect, anti-fibrotic effect. This specifically refers to the fibrosis of the liver. Okay, so basically after the liver is severely damaged, it starts to harden. Okay, so zizi has effect to help to prevent the fibrosis. All right, Gulagogic is to help to smooth out the flow of bile, so the patient won't get bile stones or bile stasis. It also helps to protect the pancreas and the stomach, the nerves, and also against radiation. All right, so those are the 3 herbs or 4 herbs. Now we switch gear a little bit. We talk about Banlangen and Daqingye. Banlangen root, it has function to clear heat, eliminate toxins, cool the blood, and also benefit the throat. Okay, treat the type of heat manifestation, pus, abscess, bleeding, and so on, possibly. The pharmacological effect is a lot simpler: antibacterial, antitoxin, antiviral, and anti-inflammatory. So once again, description is not that different, but the emphasis here is that Banlangen is a much stronger, or a very strong antibacterial and antitoxin herb. All right, so if you're using this herb to treat bacterial infection, it's going to work very well. In addition, it's one of the best antiviral herbs. Okay, so in this case, actually better and stronger than the Huangqin, Huanglian, and Huangjian with the viral infection than Banlangen and Daqingye. According to a lot of references that are done, Banlangen many different type of virus: influenza virus, seasonal influenza virus, avian influenza virus, swine virus, Japanese encephalitis and virus, and so on and so forth. Okay, so as you can see, there has been a lot of research done on what herbs have antiviral effect, and Banlangen certainly is on top of the list as far as potency of antiviral effect and also wide spectrum of antiviral effect. All right, and obviously, and this is Isata's leaves. All right, so one is root, one is leaf. So Daqingye clears heat and eliminates toxins, and then cool the blood and eliminate bleeding. again, the pharmacology is antibacterial, antiviral, antitoxin, and anti-inflammatory. And the main function that stands out is the antiviral effect of the herb. So once again, against various type of influenza virus, encephalitis virus, adenovirus, herpes virus, hepatitis virus, and so on. All right. So those two herbs, generally speaking, we have learned in school, we are familiar with. And last, I'll tell you a couple herbs that are excellent antiviral herbs that you may or may not know. All right. One of them is called Yu Xing Cao, Herba Huti Nia. Okay. And Yu Xing Cao literally means smelly fish herb. Okay. But actually, the herb is not smelly. All right. So in fact, a lot of people do eat it as a salad. Right. So Yu Xing Cao clears heat, eliminates toxins, and drains pus, and promotes normal urination. Primarily described as antibacterial, antiviral, and anti-inflammatory. And in fact, Yu Xing Cao is one of the herbs that's used the most ever since they start to treat a lot of the mutated viral infections or viral infection that originate in animals but somehow is passed on to humans. All right, so some of the antiviral effect include herpes virus, a cyclovir-resistant herpes virus. A cyclovir is Zovirac. It's one of the more commonly used antiviral drugs. Okay, so if it's not working, then Yu Xing Cao in fact still works to treat these herpes virus. Then coronavirus for SARS, influenza virus, pseudorabies virus, influenza virus, and also HIV. All right, so once again, have a lot of research is effective against a lot of different viruses. And in fact, it's also described not just as antiviral and also virucidal. And cidal means to kill. All right, so that emphasizes the potency of the antiviral effect to in fact kill and destroy the viral particles. All right, and the last herb you probably don't know is an herb called Xiangchun Ye. And this is the Folium tuna sinensis. All right. Classic description is to clear heat and eliminate toxins. So if you just read the TCM descriptions, this herb probably sounds just like 100 other herbs that clear heat, and you probably have no idea how to use it. All right, and I think this is an area where we need to do continuing education. Read about different research about the herb, application of the herb, so then you realize what the herb can actually do. All right, because otherwise, clear heat and eliminate toxin just sounds very generic. Anyways, this herb has been found to be one of the best antiviral herb to treat coronavirus and to treat severe acute respiratory syndrome, SARS, right? So what happened is years ago when SARS was a huge problem, the Asian countries have done a lot of research to find out which herb can actually be used that have the best effect to treat SARS. And Xiangchun Ye turned out to be one of the most effective. All right. So once again, if you come across different viral infections, there are some standard traditional heat clearing herbs that will work well, but also there are a lot of new antiviral heat clearing herbs that you may or may not be aware of. Okay. So again, open your mind, continue to study, then you will find a lot of herbs that have effect that you didn't know before. All right. Then the last two herbs are herbs that clear heat and eliminate toxins. That's the primary effect. And then the pharmacology is that these are some of the herbs that in fact have very good anti-cancer effect to treat many different types of cancers. Okay, so these are the herbs. One is called Banzilian, Herba Scutularia barbata. Okay, so the genus is the same as Huanglian. Okay, but the species is different, so don't get it too confused. Banzilian, in fact, is very, very good, and there's a lot of research for this herb to treat many different types of cancer. All right, so I don't have the space or the time to give you the details, but whenever I post this as separate bullets, then what happened is there are at least one, if not more, reference on this herb specifically for treating that particular condition. All right, so if you're interested, send me an email or send Donna an email. I'll give you more information. Or if you just Google online, you can find a lot of information. Anyhow, with Banzilian, what's amazing is not only does this herb have excellent anti-cancer effect, it also has herb-drug interaction in which the combination of this herb along with a lot of anti-cancer drugs help to treat cancer better. Okay, so this is a synergistic effect to better treat cancer when combined with anti-cancer drugs. So this is an example of 半支莲 combined with cisplatin to treat ovarian cancer. And this is an example here of 半支莲 in combination with etoposide and doxorubicin to treat human gastric adenocarcinoma. Okay, and the last example is combination of 半支莲 with 5-fluorouracil to treat or to inhibit tumor growth. All right, so once again, there are a lot of examples of drug and herb combined with better synergistic effect to treat infection, and also herb-drug interaction of herb and anti-cancer drug combined to better treat cancer. All right, so don't think of herb-drug interaction as something negative. There are many examples of this as a positive effect to better treat the patient. And the herb that 半支莲 is generally used in combination is an herb called 白花蛇舌草, generally described as eLotus or Odenlandia. So once again, the effect is to clear heat and eliminate toxins. And the pharmacological effect is anti-cancer. So it helps to treat, once again, many different types of cancers in the body. Okay, and similarly, it also has a synergistic herb-drug interaction to better treat cancer. All right, so in this case, it can be used with 5-fluorouracil, so the dose of the drug can be lower and you still get better effect. And the treatment is specifically for hepatocellular carcinoma, so liver cancer. And you can also use it with 5-fluorouracil to better treat colorectal cancer. All right, so those are some of the single herb as well as their traditional uses and their pharmacology. So hopefully, regardless of whether you're a brand new beginner or if you have practiced herb for a long time, there was something that was beneficial for you that you didn't know before. All right, and as far as putting the herbs together into a formula, generally speaking, what happened is, historically, obviously the TCM doctors did not have microscope, they cannot see the bacteria or know what type of bacteria it is, so we don't prescribe herb based on culture and sensitivity and what bug it is, but rather oftentimes we use herb based on where the heat is or what organ is affected. All right, so a lot of the classic formula will tell you what it does. So for example, you have a formula called 清肺汤, clear the lung decoction. So you can see that the first herb is Huangqin Scutellaria, and we describe that Huangqin, even though it treats a lot of different heat, is most effective for upper jiao, for the lung, right? So Huangqin is a key herb here to treat lung infection. So classic application is patient with lung heat, and they have cough, they have thick and sticky phlegm, sore throat, hoarseness of the voice, and so on. And the Western indication of 清肺汤 lung heat is basically some type of infection and inflammation of the lung. So you can have bronchitis, pneumonia, bronchiectasis, laryngitis, tuberculosis, and so on. All right, so that's the one example. The second example is 清肺散, clear the stomach powder. So the key herb here is Huanglian coptis. And Huanglian, once again, is an herb that treats a lot of different things, but is more effective for the middle jiao. So this is a key herb in 清胃散, which is the stomach in the middle jiao. So once again, this is a great herb for heat in the stomach. So it treats many manifestations of heat in the stomach, both locally and also going up. So you can use it for patients with gastric ulcer, duodenal ulcer, gastric bleeding, and when it flares up, maybe acid reflux, toothache, gum bleeding, and so on and so forth. All right. So Western indication is stomatitis, toothache, gingivitis, ulcerative gingivitis, peritonitis, and so on. All right. So once again, stomach heat going upwards, and all the Western manifestations of stomach heat and fire. All right. Then you have a formula called 龙胆泻肝汤, Gardenia decoction to drain the liver. So this is a formula that treats damp heat affecting the liver and gallbladder channel. So what happened is this formula has a little bit broader effect. So it helps to treat everywhere that the liver channel goes to. So what happens is you can use it for localized problem, which is damp heat in the lower jiao, or heat and fire along the entire liver and gallbladder channel. So you can use it for urinary tract infection, cystitis, bladder infection, hypertension, urinary tract infection, otitis media ear infection, and so on. So you see here, the Western indication is a lot broader. All right. So what we're doing is we're going from localized type of infection and inflammation to something that's more systemic and more broad spectrum. So you can think of the first two formula as localized antibiotic or anti-inflammatory agent, and the next examples as more systemic herbal antibiotic or herbal inflammatories. All right. This next formula is called Huang Lian Jie Du Tang Coptis decoction to relieve toxicity, and it contains 4 herbs: Huang Qin Scutellaria for upper jiao, Huang Lian Coptis for middle jiao, Huang Bai Philodendron for lower jiao, and then Zizi Gardenia for all 3. All right. So this is basically something of a shotgun therapy to treat heat and fire all throughout the body. And all the herbs are bitter and cold, and all treat heat, and there's nothing to help to nourish in or protect the underlying. All right, so remember that this is something that's bitter and cold and potent and very powerful, and should only be used for a short period of time. Okay, if you use it for too long, then you risk the herb being too strong, and then eventually damage qi and damage yin. Okay, so make sure to only use it for short term to treat the problem, and after that, discontinue the herbal formula. All right, so once again, like we mentioned, this is for excess heat, fire, and toxins in all 3 jiaos, all throughout the body. And once again, many different infection and inflammatory conditions throughout the entire body. All right, so this, in a way, is more of a Western medicine approach, basically to use very powerful drug to treat the infection and then deal with damages later. All right, so that's why this is a powerful formula, but you also want to be careful with it. All right, the last example here is an herbal formula called Pu Ji Xiao Du Yin, and this is universal benefit decoction to eliminate the toxins. And basically what it means is that universal benefit refers to a formula that benefits the entire universe. All right, and that universe could be one home, it could be one town, it could be one school, it could be all the people that live and work in a close area. And eliminate toxin and heat means these are the patients that had some type of epidemic disorder. All right, so basically, this is a formula that was used for some type of infectious, contagious, epidemic type of condition. Okay, so from a TCM perspective, this is heat, toxins, wind affecting the upper jiao. So in a way, patients who have upper respiratory tract infection, contagious, infectious, flu, bacterial infections, and so on. All right, and these are the disease names and so on. All right, so if you have these type of outbreak, okay, then this is one of the best formulas to use. All right, now let me share you some current events. Okay, this is a formula called Huang Qin Tang, literally Scutellaria decoction. And this formula is getting a lot of study done right now in the United States from both clinical application perspective and also quality control perspective. And what they are doing, let me tell you about the formula first, is that this formula is originally from Sang Han Lun, co-induced disorder. It's about 1800 years old. And the formula has 4 herbs. One is Huang Qin Scutellaria, one is Bai Sao Huai Peony, one is Gan Cao licorice, and Da Zao fructus jujube. And historically, this is a formula used to treat damp heat dysentery with mild fever, bitter taste in the mouth, abdominal pain, diarrhea, dysentery, red tongue, and so on. All right. So a formula for treating damp heat dysentery. Once again, damp heat describing a localized problem, and only 1 out of 4 herbs is a heat clearing herb, and that will be Huang Qin. The other 3 are all tonic, yin nourishing, protect chi tonic, and preserving type of herbs. All right. So what they have found is that this herb, or what they are studying, is that this is a formula that they hope will treat the toxicity caused by a chemotherapy drug called irinotecan. And what happened is, for a chemotherapy drug, it is very bitter and cold, and it causes a lot of localized damage, even though it treats the cancer cells. So the patient usually ends up with a lot of gastrointestinal toxicity, inflammations, damage to the mucous linings, and so on. All right. So what they have found is that this herb, or this formula, help to restore the intestinal epithelial lining by promoting the regeneration of the intestinal stem cells. Okay, and at the same time, it has anti-inflammatory effect by decreasing the neutrophils, macrophages, and also decreasing the pro-inflammatory cytokines such as tumor necrosis factor, nuclear kappa Bs, and so on. So basically, what they found this formula to do effectively is to reduce the inflammation, which is heat, and also restore the intestinal mucous linings and epithelium, which is the damage, which is the indeficiency in Chinese medicine, right? So if you think back to the herbal formula, once again, this is a formula with Huangqian to clear heat, so that's to treat the inflammation. And then the three other herbs to nourishing and tonify qi, that is to restore the normal functions and the normal structure and anatomy of the body, and that's the intestinal epithelium. All right. So why this formula is so helpful in Western medicine, or compared to Western medicine, is that not only does it treat the infection and inflammation, which Western medicine does very well, the Chinese herb, the three other herbs, help to restore and minimize the damage. And that's one area where Western medicine generally fails the patient. All right. So as you treat the heat, make sure you also nourish the yin and tonify qi as well. Otherwise, the disease may be treated, but the patient is going to be left with damaged battle wounds. All right. So you want to minimize that as much as possible. All right. So this formula, if you do a Google search, if you do some research, you will find that there's a lot of information. All right. So if you all tie it back to Chinese medicine, it's actually very, very exciting. All right. So that's the heat clearing portion. And let me just quickly go through some of the collection formulas if you are more familiar with those, as far as what the main indications are. All right. So this formula is called Gardenia Complex. This is a formula basically to use for the early stage of exterior infection. And it's good because it treats both bacterial infection and also viral infection. The main ingredients are Jinlinhua and Lianqiao, Gardenia and Forsythia, and they help to treat bacterial infection. And then Banlangen and Daqingye, Isatus leaf and Isatus root, and they are very effective for treating viral infection like we talked about today. So if the patient has an early stage infection, this formula will treat either it's bacteria or viral. Okay, if the infection is affecting upper parts of the body, so they have ear, nose, and throat infection, then herbal ENT is the best formula to use. All right, so it treats infection in the head and also in the upper respiratory tract. All right, if for some reason the infection is not properly treated and it goes into the body, usually the first part of the body that it goes to is the lung. All right, so this is a good formula to use called respiratory heat, and basically a formula that treats lung heat. All right, if the infection is caused by something completely different, it's caused by microorganisms that's in the food or goes to the stomach and intestines. So basically, this is something for stomach heat. Then you're going to use GI care. Okay, this is specific for stomach heat. Okay, or if the heat goes to the intestines. All right, so the patient has traveler's diarrhea, gastroenteritis, okay, food poisonings, and so on. Then GI care 2 refers to the intestines. Think of it as small intestines and large intestines. All right. Then this is a great formula for infection and inflammation affecting both of the intestines. All right. And then you have GI care UC. UC refers to ulcerative colitis, okay, or Crohn's disease. Okay. So this is a great formula for inflammation affecting the colon. Oh, they can hear me? Okay. Let me pause for just a second. I think we so usually it's quite reliable. I'm not sure what happens. It's good? All right. So this next formula is liver detox or liver TTX. This is quite interesting because this is a great formula for DMP affecting the liver. Okay, and so basically, patient with elevated liver enzyme, hepatitis, and so on. And in addition to using herbs that are great for draining DMP from the liver and gallbladder, it also has some astringent herbs that help to restrain the DMP. Okay. Anyways, if you want to find more information, you can always go to the clinical manual. It will give you far more detailed explanation than I can tell you over a 1-hour webinar. Okay. And lastly, some of the herbs that are quite interesting are in this formula called Herbal ABX. And this is an herbal antibacterial formula that if for some reason you are treating some type of bacterial infection and the herbs just don't work, then this formula has a lot of Huang type of herbs that retain a lot of antibacterial effect when the bacteria just simply doesn't respond. And these are the herbs such as 茶匙黄, 虎咬黄, 柳枝黄, 鼠尾黄, 鸭舌黄, and so on. All right. So this is a formula you can use as an adjunct to any of the formula for treating infection, and it will give you added assurance that it's going to work very well to treat the infection. And similarly with viral infection, if for some reason the classic formula doesn't work, like in Chaoshan, for some reason it doesn't work, this formula has a lot of antiviral herb that you can use as an adjunct formula to the classic formulas or any of the formulas, and that will give you added assurance that you will help to treat the viral infection with a much better success. And some of the herbs are the ones that we in fact mentioned earlier, such as Yu Xing Cao, okay, and also where's the other one? Well, anyway, a lot of other added antiviral herbs, okay. And the last formula here is Gardenia Complex, and this is a formula that helps to treat heat in the upper, middle, and lower jaw. And it's a formula that have excellent antibiotic effect to treat infection, anti-inflammatory effect to treat various type of inflammatory conditions, and it also helps to suppress the hypermetabolism and elevated metabolism. So in a way, a broad spectrum heat clearing herb with many different effects. And in a way you can see because it does have many herbs with many different functions. All right. And this formula is called CA support. It has two of the main anti-cancer herbs to help to suppress the growth of the cancer cells, along with herbs to tonify Qi and nourish Yin. Okay, because you don't want to just clear heat in treating cancer. You really need to support the underlying health of the body. All right, so that is a very quick look into heat clearing herbs. Okay, and this last here is one of my favorite slides. This is a book called The Sanford's Guide to Antimicrobial Therapy. And what's interesting is that it has these two characters on the front cover of the booklet called 热病, and that literally means heart diseases. And if you had the book and flip to the inside front cover, it says that these are the two words taken from 黄帝内经, Yellow Emperor's Inner Classic, implying or saying that the heat disease that we know in Chinese medicine, in fact, is the infectious disease that we know today. And what happened also is that the bitter and cold heat clearing herb, in fact, have excellent antibiotic effect. Okay, so I think this is a book cover that helped to bring the two sides together. Regardless of whatever difference Chinese medicine and Western medicine has, there is in fact a lot of similarities as well. All right. So hopefully we all look at it just as one medicine instead of all the different divisions. All right. So that's it. If you want additional reference, these are the books that my sister and I wrote on a single herbs called Chinese Medical Herbology and Pharmacology. If you need to look up information on the herbal formulas, this is a reference called Chinese Herbal Formulas and Applications. If you are looking for information on the contemporary formulas called the collection formulas, then the best source to go to is Clinical Manual of Oriental Medicine. And in fact, there's a third edition, so for the next class, I'll be sure to update the slide. All right, so that's it. Thank you very much. And well, I think we're out of time. Okay, so if you have any questions, send the email to Donna, and then we'll post the answers to all of you. Thank you.
All right, guys, that's it for today's class. Thank you, Dr. Chen, and thank you, everyone, for joining us. Sorry about the little hiccup that we had earlier. I don't know what that was, but what is it called? We call it the internet gods. The internet gods have spoken, but they let us back in, so that's a good thing. All right, guys, the class was recorded, so if you want to watch it, we will have it available tomorrow afternoon, and then you can rewatch it at your leisure, and we'll also post it up on YouTube. So that's it for today, guys. Thank you so much, and have a great rest of your week. Bye.